Hello and welcome to the Lancet Voice. My name is Niall Boyce. I'm one of the editors at the Lancet. Now here's a question. Do you know how many people worldwide are living with viral hepatitis? I didn't know myself until my colleague Miriam told me that it's actually 287 million people, which seems an astonishing number and really reinforces that it's time to take stock of how we're progressing in the elimination of this disease. World Hepatitis Day is observed annually on July the 28th, so it's just around the corner. This seems as good as ever a time to talk about it, and I'm delighted to be joined by Dr. John Ward. Now, John Ward is the director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health. So he's also a senior scientist at the US Centers for Disease Control and Prevention, and he's assigned to this particular position. He has been over a 13-year tenure as director of the CDC's Division of Hepatitis, responsible for viral hepatitis surveillance, prevention, research. At the national level, he led development of recommendations for hepatitis A and B vaccination and B and C testing and linkage to care. So no better guest to have to talk about this important issue. John, welcome to the podcast.
It's nice to be here. Thank you.
So, John, we were talking just before I started recording, and I mentioned that I'm a psychiatrist by training, so I might need a little bit of a reminder about viral hepatitis. Now, we know that there are 5 viruses, A through E. I wonder if you could just run me through what the distinction is between these viruses in terms of transmission, in terms of the health effects. Are you able to do that for me?
Sure. Very quickly, viral hepatitis is a highly prevalent group of infections around the world. And they're called, as you described, hepatitis A through hepatitis E. Importantly, hepatitis A and hepatitis E are viruses that are spread through poor sanitation, through exposures to other persons' fecal material, whether that be in food or water or direct person-to-person contact. They cause inflammation of the liver. That's where the itis and the hepatitis comes from. And then people tend to get sick, but then can clear those infections and remain protected thereafter from those infections of hepatitis A and hepatitis E. Hepatitis B and hepatitis C are also cause hepatitis, inflammation of the liver, but they were what's known as blood-borne viruses, where they're spread through contact with other person's blood, such as through poor, unclean injection equipment is used in healthcare or in communities, such as persons who inject drugs. Importantly, for hepatitis B in particular, spread at the time of birth from an infected mother to a newborn, spread within households through incidental exposures to blood, such as sharing toothbrushes, for example, or shaving equipment. And then there's a Delta virus, or that's the D, that is a companion of hepatitis B viral infection and actually requires the hepatitis B virus to replicate. Importantly, hepatitis B and hepatitis C cause chronic infection. They set up shop in the liver, continue to replicate, slowly damage the liver after that acute event happens right after transmission. And then the liver slowly gets damaged, becomes scarred, progresses to end-stage scarring known as cirrhosis, and then development of liver cancer. Very quickly, the way I try to separate this is A and E, or vowels. So think of bowel and bowel, that they're spread by fecal transmission, whereas B and C are blood-borne viruses that cause the chronic infections. And they're really the major causes of hepatitis from viral hepatitis because of these chronic infections leading to cirrhosis and liver cancer.
And you mentioned that they're blood-borne. How much sort of volume of blood? As I remember, it's actually not that much that you need to transmit these viruses.
Microscopic, these viruses are replicated in very high volumes. And so their transmission risk is tremendously high, even with just very, very small amounts of exposures to blood from infected people.
So what we'll do in this podcast then is really focus on B and C. And I find it interesting that we're talking about elimination. Now, elimination isn't something that we talk about with all diseases, even all infectious diseases. What is it about Hep B and C compared to, say, HIV, which means that talking about elimination is a realistic prospect?
Well, first of all, hepatitis B virus and hepatitis C virus, they have to meet certain criteria to even be considered to be targets for elimination. Beginning with the fact that these are spread pretty much from person to person. They're not shared by other animals. And also, they don't live that long in the environment. And so they're not laying around in water and food and on surfaces for months that can be sources of transmission. Then secondly, you have interventions that can make a difference by either preventing the viruses right up front from transmission or catching people very early in their course of their infection before they become very ill. And unfortunately, we have those interventions at our disposal for hepatitis B, particularly hepatitis B vaccination, and for hepatitis C, where we have curative treatments, indeed the first cures for a chronic viral infection in the history of medicine are now available to us. And then with a reliable test available around the world, we can detect people early and get them treated and cured of their hepatitis C.
Okay, so from that answer, my immediate thought is, so how come we haven't eliminated? But we'll come to that later. I'd like to talk a bit more about this vaccination for Hep B. I mean, who gets vaccinated and how early in life? What's the current recommendation on that?
Well, we've had a hepatitis B vaccine since the early 1980s, actually. And through research over the 1980s, it was recognized that people at highest risk of becoming chronically infected with the hepatitis B virus were newborns and infants. And so if a newborn and the risk of transmission, if the mother's infected, can vary from 20% to as high as 80%, depending on the viral load of the mother. If that newborn becomes infected, 90% remain chronically infected, and without detection and treatment, 1 in 4 die prematurely in adulthood from liver cirrhosis and liver cancer. For infants, less than 5, that's 30 to 50% risk. So that vaccination is tremendously important for infants beginning in newborns, preferably within that first 24 hours of life. Because if you think about it, the newborn's already been exposed to the virus. The virus is already replicating in the body. So the sooner you can give that newborn that vaccine to stimulate that immune response to get ahead of that infection, the better. And so that has been our real main effort over the last several decades to improve infant immunization, and then for that infant immunization to start immediately within the first day of life for newborns.
As you know, unfortunately, it's impossible now to talk about vaccines without talking about anti-vaccination and anti-vaccination activists. Now, we've heard about this in the context of COVID. We've heard about this in the context of MMR. The way you've described it, there's a very plain case for Hep B vaccination in newborns. Is there any opposition to this? And if so, how do you persuade people of your case?
And I think, there's always, justifiable concerns about what are the risks and benefits of vaccines. In the case of hepatitis B birth dose vaccination, of which has been used now for several decades and hundreds of millions of children have received it, there is no serious adverse events that happen from hepatitis B vaccination. And indeed, when you look at all the vaccines that are given to children, hepatitis B vaccine prevents more deaths than any other vaccine given to children except for measles vaccine. So a recent estimate, 22 million deaths have been averted through children receiving Hep B vaccine since 1990. And that number will probably go up to about over 30 million over the next 6 to 7 years of additional vaccination. So we continue to monitor safety as part of the vigilance, but also recognizing that there's huge benefits of hepatitis B vaccine. And then you get to a point where the disease has become so infrequent because of the vaccine success that the people that are not in favor of vaccination begin to say, well, we don't need vaccines anymore because we have no disease. Well, you have no disease because you've been vaccinating. So you just have to continue to educate everyone about the benefits of vaccination while continuing to monitor to make sure that these vaccines remain safe. And that certainly is the case for hepatitis B vaccine.
People have short memories, I think it's fair to say. So the picture worldwide, you've described these amazing numbers of children's lives which have been saved by this vaccine. What's the picture worldwide with Hep B vaccination? Is this something which is a sort of universal rollout? Are there barriers to rollout? Are they financial, logistic? What's happening here?
Well, there's always all of those barriers. Very early, when in the 80s and 90s, the cost of vaccine was a real problem. Then the prices of hepatitis vaccine began to drop. You had logistical challenges about giving the vaccine to children. Fortunately, what's called pentavalent vaccines, where you get a combination of vaccines all grouped into one shot. That includes hepatitis B vaccine. Been tremendously helpful in making sure infants get the vaccine. Then you have this particular challenge of how do you get this vaccine to an infant in that first day of life? And you really have to engage obstetricians and birth attendants to become vaccinators. And when that's done effectively, you get high coverage with birth dose and huge declines in transmission. And so these elimination goals can be achieved. Countries in Asia, which have high burdens of hepatitis B, like China is a shining example of a country that used to have 12 to 14% prevalence of hepatitis B. They implemented the hepatitis B birth dose vaccination program along with infant immunization. And now that prevalence among vaccinated people in China is below 0.5%, which is one of the global elimination targets. And other countries have achieved similar success. The biggest challenge right now is in Africa, where you have high burden, but only about 1 in 5 infants receive a birth dose vaccine within that first day of life. We're trying to change that as a coalition. And if we can change it to reach that 90% target, such as China have achieved, we can avert over 500,000 deaths from liver cirrhosis and liver cancer among children vaccinated this decade in Africa. That just shows you the immense impact hepatitis B vaccination can have.
So as you say, this is a really worthy target to aim for. But of course, there are people who don't receive the vaccine, who develop the condition. And for them, we need to think about treatments. Now, I understand there's a paper recently published in the New England Journal of Medicine on a new treatment for hepatitis B. Is that correct?
That's right. Introducing what's termed a functional cure for hepatitis B. The current treatments require essentially lifelong treatment to continue to suppress the virus for a long period of time so you don't get that progression of liver disease to end-stage liver cirrhosis and liver cancer. And that's effective about 50 to 60% of the time. And these are very low-cost medicines. And so there's clear merits in getting people tested now, getting on the treatments that we have available now around the world. Unfortunately, very few people in this large millions of people who have hepatitis B, only about 10% or so have been diagnosed and are in care at all. So that's a huge challenge that we're seeking to, and so that they can benefit from the current treatments. Now, what's a new opportunity that you raise is that through research over the last several decades, there are new, even more effective treatments that are about to become licensed and made available around the world, which are injectable medications that can be given on a weekly or every other week basis for a 6-month period. And about 1 in 5 to 1 in 4 people will achieve a silencing of their viral infection so that they do not have to take any medicines anymore for the rest of their lives, as is based on the data that we have now available. So this ushers in a very new, exciting opportunity to really improve the health of people with this chronic infection that are facing premature mortality from liver cirrhosis or liver cancer. For us as a coalition, and we celebrate these advances, but we want these advances to benefit everyone around the world, and not just those in highly developed countries of Europe or Asia or the Americas, but really to see over time, as we have done successfully for HIV, how can we make these medications available to the millions in low and middle income countries that are living with this infection?
So if we talk about, say, hepatitis C, where you said this is the first time that there's been a cure for a chronic viral infection in the history of medicine, and where are we with scaling up that treatment at the moment?
It's truly a remarkable situation for hepatitis C treatment, where you have these drugs now that can be given on a one pill a day or several pills a day for 2 to 3 months. You achieve a 95% cure, reduce the risk of liver disease and mortality from that liver disease of about 80%. Drugs have shown themselves over 10 years now to be extremely safe, very few side effects, very few drug-drug interactions, and actually patients don't even have to take the drugs that reliably to get this 95% cure. And the drugs have come down tremendously in price now, where because of generic manufacturing options, you're talking about what used to be a $95,000 regimen is now down to less than $200 in low and middle income countries. And we have shining examples of how countries such as in Egypt or Rwanda have put in place highly effective programs, even though they're low and middle income countries. People are getting treated in the US, in the UK, and in Europe. The UK has put in place, for example, a very robust program to treat prisoners and people who inject drugs, since they're often at the highest risk of hepatitis C because of those unsafe injection practices. So when those programs are put in place, these drugs are so effective that you do achieve these elimination targets. So our biggest challenge for elimination is just increasing awareness of the burden of hepatitis B and C, the interventions that are cost effective and cost savings and that can be put in place so that you get those political commitment in countries around the world to support programs that make these interventions available broadly in their countries so that you do get the broad scale impact and that is necessary to achieve these elimination goals.
Yeah, so I'd like to talk about this big picture. You talk about having political commitment, and I think a lot of the time, political commitment comes from politicians. First of all, you quoted the numbers. You can improve lives, save lives. There's clearly some sort of financial stake in that as well. But then there's also this perhaps less tangible issue of why is it important? What's the human story behind it? What's the benefit really of tackling this condition, this disease? And while I think that there are some illnesses such as HIV, which still have a large degree of public awareness, I'm not sure that Hep B, Hep C have ever really garnered that degree of awareness and support. And I wonder why this is. Is it because of the geography of it? Is it because of the demographics affected by it? And how do you turn that around?
No, it's such a good question. And for myself, as a 14-year veteran of working on HIV, where you saw that community concern and mobilization really translate into political commitment for strong programs. We strive for that for hepatitis B and hepatitis C, but yet we don't have it, even though there are more deaths now from hepatitis B and C than from HIV. I think it's because the liver is such a stealthy organ that people feel quite well for many, many years, and then you get this sudden onset of liver failure and liver damage. So people underestimate the health threat that is hepatitis B and hepatitis C. There are other causes of hepatitis and liver cancer, such as obviously alcohol or now fatty liver. So I think there's some confusion there. And then with the lack of diagnosis, there's even, that contributes to the lack of awareness. So a big effort on our part of the coalition is to raise that awareness. For example, we've developed an organization of member states at the United Nations that want to build global solidarity toward these goals for hepatitis elimination. And we've brought together 64 countries now at the UN, sharing this global commitment and striving for more to be done. So it's just one example of how we are working to increase the call for action to reach these targets for hepatitis B and hepatitis C elimination. And if we can do that, we can avert 7 million deaths from hepatitis B and hepatitis C. So that's the payoff. And so as we strive to build the evidence through this sound science, guide program development, advocacy is tremendously important to raise awareness of the health threat of hepatitis B and hepatitis C and the benefits of prevention and care and achievement of these elimination goals.
Elimination it's a big word. It's a big aim. Is it, do you think, a realistic aim? Is this the case that in how many years is your target for elimination, and what stands in the way at the moment?
There has been tremendous progress toward elimination of hepatitis B and hepatitis C already. As I've already mentioned, a large number of deaths averted through hepatitis B vaccination. The world is on track to reaching goals for the elimination of hepatitis B through vaccination of children with a vaccine, I should add, that has been shown to protect persons for at least 40 years after vaccination. So that child is protected well into adulthood. So you're really talking about every year you have more and more people that have received this vaccine that are not going to get hepatitis B in later life. So you're really talking about future generations that are protected from hepatitis B. So that's really a shining example of that. There's also been huge improvements in healthcare safety, where there's less transmission because of the use of clean injection equipment and other good infection control procedures. And so again, if you look over the last several decades, millions of deaths have been averted just through improvements of infection control. So we're left with our remaining biggest challenge is testing, detection of those infected, of this almost 300 million people, as you mentioned. Most of those people do not yet know they're infected, silently progressing toward hepatitis, cirrhosis, silently progressing toward liver cancer. 70% of liver cancer around the world is caused by these two infections. Liver cancer is the third leading cause of cancer deaths. So this is a huge need and huge opportunity. The biggest remaining gap toward us claiming success in achieving goals for hepatitis B and hepatitis C elimination is getting people tested, into care, and treatment with the current treatments, with these new treatments for hepatitis C that you've already touched on, and with these low-cost, highly effective cures that we have in hand already for hepatitis C.
So do you think we'll see elimination within our lifetime?
Well, I'm trying to stay as healthy as possible, so I can say yes to that question. But I think we already are seeing it, certainly for hepatitis B through vaccination. And when countries put programs in place, things are happening. So I think it's an open question of whether we will achieve the global targets by our target date of 2030. But I think we will have a growing number of countries that have achieved those elimination goals. And then there will be a year when we will achieve those targets for hepatitis B and hepatitis C elimination.
So how will you be spending World Hepatitis Day on July the 28th?
As you can ask members of my family, I talk about hepatitis elimination all the time, so I'm sure I'll be talking about it.
Every day is World Hepatitis Day in your household, yeah.
Every day is Hepatitis Elimination Day for me and for our coalition and for our partners. We invite everyone, to join us. The payoff is huge. We have these treatments, vaccines, diagnostics at our hands. We have shown that when they're put in place, elimination is achieved. We just need more political commitment to achieve it globally. So I invite everybody to join us at the coalition at globalhep.org and join our effort.
Thanks, John. Now, if you're interested, you can learn more about how the task force and its partners are working to help eliminate hepatitis on their website and at the World Hepatitis Day website. And the World Hepatitis Day website it's very simple. It's just www.worldhepatitisday.org. So do go and have a look there. Also, please do look on thelancet.com for all of our content on viral hepatitis. Thank you again, John, for joining us today. Thanks to you, the listener. Do like and subscribe subscribe wherever you get your podcasts, and we'll deliver a new episode about every 2 weeks covering the most intriguing and complicated issues in health today. But for now, goodbye, and I do hope you'll join us again next time.